When we talk about joint care, there's just this endless sea of creams and gels out there, right? But for a lot of people, especially the pros in physical therapy and sports medicine, the results can feel, well, pretty temporary. Today, we're going to look at a professional solution that claims to work on a whole different level.
And it's a really fair question. I'm sure you've asked yourself the same thing. You put something on, you feel a little bit of heat or a cooling sensation for a minute, but that deep down issue, it's still there. So what is the real problem with so many of these typical topicals?
And here it is. This really hits on the main limitation. Our skin is an amazing barrier. It's designed to keep things out, which is fantastic for protecting us. But it also means that most of the stuff you rub on just sits on the surface. It can't get deep enough to where the support is actually needed, in the joint and the tissues around it. So if you want to get past that barrier, you need a totally different game plan. The goal shouldn't be just to kind of mask what's happening on the surface. The goal has to be to create a real effect deep inside the tissue itself.
And this is where Si14 VECTOR JOINT comes in. I want you to pay close attention to the language they use here. It's not called a cream, it's not a gel, it's a molecular dermal solution. That name alone tells you we're talking about a completely different way of doing things.
I love this quote. Calling it an instrument? That just completely changes how you think about it. An instrument suggests precision, it suggests professional use, and it suggests a targeted effect that's way beyond what a simple cream could ever do.
So this is the key idea behind it, a molecular conductor. The best way to think about it is like a special key that can unlock the skin's barrier. Its whole job is to get through those outer layers so it can support what's happening underneath, boosting circulation and helping to ease that deep tissue tension.
But okay, how does it actually do that? How does it work? Well, that brings us to the vector science, and it all boils down to one very special molecule that acts as the delivery system.
The star of the show here is dimethyl sulfoxide, or DMSO for short. For decades, scientists have been fascinated by this stuff because of its really unusual ability. The way its molecules are structured lets it pass through the skin incredibly well, a property that almost nothing else has. And this graphic does a great job of showing the difference. On the left, you see the idea of a normal cream. It just kind of stays on top. But look at the diagram in the middle for vector joint. You can see those molecules bypassing the barrier and traveling way down deep into the tissue. It's the perfect picture of that instrument idea we were talking about.
And it's not just about getting through the skin. Once it's in there, DMSO does other important things. It helps support the local metabolism, it helps balance heat and fluid. Basically, it works to create a much better environment for your body's own natural recovery process to kick in. So as you can probably guess, because of how this works, this isn't something you just casually rub on. Si14 VECTOR JOINT is absolutely designed for professional use, and that means following some very specific protocols.
You're going to find this being used in some highly specialized fields. We're talking rehab centers, sports medicine clinics. It's used by physiotherapists who need really effective tools to help their patients recover, especially from serious overload.
So what does that look like in practice? Let's walk through the standard compress method. It's a very deliberate process. First, you clean the area. Then, you soak a gauze pad with the solution and apply it. You cover it up to keep it in place, and then you just let it sit for about 20 to 30 minutes. And this last step is really important. After you take the compress off, you don't wash the area for another hour or two. You let it keep doing its work.
And the protocol isn't a one-size-fits-all thing. It can be adjusted. This little table shows the two main ways it's used. The basic compress we just talked about is usually for a longer course, maybe 10 to 15 sessions. But for something more immediate, like after a really intense workout, there's a shorter local application that's done over just 5 to 10 procedures.
Okay, so let's think about this for a second. If you have a substance that is literally designed to travel through your skin, its purity becomes absolutely incredibly important, right? You have to be 100% sure that the only thing getting through is the active ingredient. And that's exactly why you see the Swiss branding here. It's not just for show, it's a universal symbol for pharmaceutical-grade quality and precision, which for a product like this is non-negotiable. The reason for that obsession with quality is because of what's inside. As this slide says, the composition is as simple as it gets, 100% high-purity dimethyl sulfoxide. That's it.
And that means there's absolutely nothing else. Zero preservatives, zero fragrances, zero other additives that could potentially be carried into your tissues. The formula is designed to be a pure, clean, professional instrument.
Now, because this is so potent and so pure, it comes with some really important safety rules. This is strictly for external use on the body. staying away from the face or any sensitive areas. A little skin test before the first time is always a good idea. And you definitely don't want to use it on broken skin unless a professional tells you to. These rules just hammer home that this is serious, professional-grade stuff.
So when you put this all together, the science, the purity, the protocols, it kind of leaves us with this big, interesting question, doesn't it? As our understanding of the human body gets better and better, are we finally moving past surface-level treatments and towards these kinds of molecular delivery systems? Could this be the future? The ability to precisely target tissues, non-invasively? It's definitely something to think about.